Assistant customer information marshal. And our foundation is contributing millions of dollars to charities helping with COVID-19. Our promise is the other side. When you shop your home care, you get way more information. You get thousands of items you need to your door fast. The way it works best for you. Even the big stuff. You get a delivery experience that you always count on. You get your perfect find at a price to match on your schedule. You get free 2-day shipping on the things that make your home feel like you. Wait there, way more than furniture.
We think we have it very well under control.
What did they? The president's focus was not on this coronavirus.
One day it's like a miracle, it will disappear.
CNN's Jake Tapper investigates what really happened. The pandemic and the president. Tomorrow at 10. When workers are injured, doctors sometimes prescribe opioids to reduce pain. They are effective, but they can be addictive. And that's when everything can spin out of control. Bringing down careers, families, loved ones, and even lives. It's time to turn this serious problem around. Let's work to reduce opioid addiction now. Chesapeake Employers Insurance Company can guide employers and their injured workers.
This is a paid advertisement for legal service. I'm Jay Henry Ball.
Military service members who went to combat armed vehicles between 2003 and 2015. Rehab has agreed to pay out $9.1 to resolve allegations that they sold defective earplugs to our troops. If you have limited or tonight, entitled to compensation for 3 hours, not the U.S. government. The time is running out. Call now for a communication meeting.
I'm Arizona in New York, and this is CNN.
Closed captioning brought to you by MesoBook.com.
Mesothelioma is all we do. For over 10 years, we have offered a free book on mesothelioma. Call 1-800-400-2802.
Antibody testing for millions of Americans is critical during this pandemic, but getting your hands on one can be very difficult. Much of the testing available today is for people with underlying conditions or specific occupations. But now, renowned hospital in Denver is making antibody testing available for absolutely anyone who wants it. CNN's Gary Tuckman goes through the process and shows how easy and stress-free it is.
The COVID-19 antibodies has not been easy to do. If you aren't a first responder or healthcare worker, and this was one thing we could do to really reduce the barriers to care and expand access. At Denver's National Jewish Health Medical Center, if you want an antibody test, you can get an antibody test. You don't need connections or even a doctor's recommendation. You make a reservation and drive into a parking lot. I have a couple of questions for those here. This type of interview starts an easy process. Hello there. How are you doing today? How are you? Pretty good day. My name is Gary Tuckman. All right. We're going to go real quick. Thank you. I made an appointment a day before to get a close look at a process that will hopefully get more and more common across the country. And to answer a question as I continue to cover stories on CNN. Have I already had COVID-19?
Got any fever?
No.
Okay. Any new or worsening cough?
No. Following the interview, you walk into this trailer for a 10-minute visit, get your blood drawn. You did a great job. Right in the vein, right? All right, good. Thank you. My blood and the blood of others. Campus into this lab. The vials go into a centrifuge.
And Gary Tuckman. Sorry, I'm right here.
That's mine, eh?
That's yours.
Molly Wolf is the lab supervisor.
This process is called alkalize, where we filter serum off local blood.
And then this is the final step for our blood. This machine is called the Automated ELISA Analyzer. Analyzing will take a little over 4 hours. test has been submitted for emergency use authorization to the FDA, plus $94, but is eligible for insurance coverage. Hundreds of tested here each day. So while it's important for this country to have a better have or have had COVID-19, what does it mean for any of us who test positive for the antibodies? I would not regard that. So even if you have it, you do not know how much protection you do or do not have and how long that protection will last. Well, my guard will definitely be staying up either way. I got my results the next day. The determination, not detected, which means negative. I have not had the coronavirus. Gary Tuffman, CNN.
All right, hello again, everyone. Thank you so much for being with me. I'm Frederica Whitfield. We begin with the U.S. entering a new phase in the fight against the coronavirus. This weekend, more than 30 states are partially reopening. By the end of next week, that number will be at least 42. Easing restrictions means that restaurants, stores, and even shopping malls are permitted to get back to business. Despite that, there are still some businesses taking a more cautious approach, choosing not to reopen. California to Michigan, governors are facing increasing pressure to end weeks-long stay-at-home orders. Demonstrators have even gathered demanding a return to normalcy. Meantime, a possible hopeful sign that a treatment for coronavirus is in the works. The FDA is giving emergency use authorization to the drug remdesivir, allowing hospitals to treat patients with severe coronavirus cases. With a team of reporters covering the state reopenings across the country, just moments ago, officials in Florida released new data about the amount of coronavirus deaths occurring inside nursing homes in that state. CNN's Rosa Flores has the details from Miami. Rosa.
Well, Fred, we have been monitoring the amount of information that has been released when it comes to deaths in nursing homes for a while now. And on April 19th, it was the first batch of information that was released. And at that point in time, 23% of all of the COVID-19 deaths in the state of Florida were related to nursing homes. Well, new data was just released, and now it's 32.5. Nearly a third of all of the COVID-19 deaths are linked or associated to nursing homes, and this is residents and staff. Now, it's important to note that for the first time, we're also learning the names of the facilities that are associated with these deaths. Now, we've been monitoring, of course, just about every press conference that Governor Ron DeSantis has had on COVID-19, and he had mentioned before that there were 2 outbreaks in the state of Florida, one in Suwannee County and another in Broward County. But now, by looking at this new data that was released, we can tell that there have been multiple deaths at certain nursing homes. 3, for example, have 14 deaths associated with them. Another one that has 12 deaths. So this gives us a better idea of what was actually happening in these nursing homes. Now, it's important to note that Ron DeSantis has sent strike teams to nursing homes across the state to test both symptomatic and asymptomatic residents and staff to try to control this, and also very early on restricted visitations to nursing homes. But the governor himself has said during multiple press conferences that while some nursing homes have followed the rules, others have not, which makes this next point very important. There is a federation of about 600 nursing homes in the state of Florida that are asking Governor Ron DeSantis to give them immunity, in essence, to free them from liability. And Fred, Governor Ron DeSantis, at last check, has not made a decision yet. He's still weighing his options, has not announced whether or not he's going to give nursing homes immunity in the state.
Fred. All right, we're to Florida and Miami. Thank you. President Trump has called on the governor of Michigan to make a deal with angry protesters he calls very good people. This after demonstrators stormed the state capitol, some carrying long guns, demanding that the state be reopened immediately. CNN's Ryan Young joins me now from Lansing, Michigan. So Ryan, what are you learning?
Hey Fred, let me tell you something. These were dramatic pictures that a lot of people across the country have been talking about. We did find out that it's actually frowned upon, and you can't take signs into the state capitol, but you can open carry into the state capitol. That's what these protesters decided to do. Let's look at some of these images because they were dramatic. Obviously, they were there to have their voices heard. They wanted to make sure the stay-at-home order was rescinded. But the Governor Whitmer, decided to extend it through the end of May. You can understand why by the numbers that they've been experiencing in this state in terms of almost 40,000 people contracting the COVID-19, and then you have nearly 4,000 people dying from it. But across the state, there are different ramifications for it. There have been some places that obviously haven't been hit as hard by COVID-19, and some of those folks want to get back to business. But when you go to cities like Detroit that have been hit very hard, the stay-at-home order has absolutely worked. But listen to the governor talk about the reasons why she believes this is a health emergency and we need to continue to stay the course.
Yesterday's scene at the Capitol was disturbing, to be quite honest. Swastikas and Confederate flags, nooses, and automatic rifles do not represent who we are as Michiganders. This state has a rich history of people coming together. We're not in a political crisis where we should just negotiate and find some common ground. We're in a public health crisis. We're in the midst of a global pandemic that has already killed almost 40,000 people in our state.
Fred, look, I've covered protests all across this country. I can tell you this is a small protest by the number you're talking about, 400 to 700 people. When you think about the impact of this state, look, more people have died than showed up at that protest yesterday. Yes, you can understand why businesses want to go back to work and why people want to see their livelihoods re-stimulated by this. But when you think about the numbers here in Michigan, and how fast COVID spread throughout the state, there's a reason why the governor is pushing forward with this. Again, the stay-at-home order has been extended through the end of the month.
Ryan Young, thank you so much for that. In California, thousands of protesters packed a popular beach in Orange County after Governor Gavin Newsom ordered beaches there closed. The governor said people were not following social distancing orders. CNN's Paul Verhammond is in Huntington Beach, where that protest took place yesterday, but then had a look there.
Well, it looks calm right now, Richard, and in fact, you look behind me, a lot of people have taken the opportunity to go out and serve, and often get the a couple of backup. We're hearing the police warn people about getting off the beach and the pathways, but so far we're not seeing citations. The state said we want to educate people about, of course, Huntington Beach and its attorneys feel that they were blindsided by the governor, singled out, picked on. Then they went to court late yesterday and tried to get a temporary restraining order to allow everyone back on the beach. The judge denied this order. The Attorney General, of course, argued for Governor Newsom, said, look, we're in a pandemic. Safe social distancing is important. And for the people here in Huntington Beach, talk to some of these surfers. They were absolutely floored by the governor's decision. This is Beach City. They feel like it's a California birthright to go out and go surfing. Huntington Beach has done an absolutely remarkable job. And notwithstanding, the governor issued this order shutting our beaches. We feel targeted. I think it's punitive. And if it was really a matter of statewide concern, which is his purview, he would have closed all the beaches up and down the state. But he didn't. He's picking on Orange County. He's picking on Huntington Beach. And the empirical data, the data about spread and cases and deaths here in Huntington Beach, Orange County, absolutely do not support Orange County has 3 million people. There have been 50 deaths in Orange County. But on that flip side, that Attorney General again arguing, we have got to stop the spread of this virus. Social distancing is critical at this time, and basically alluding to what many said in the county of Los Angeles, which is we don't want to undo all of the good work with a busy weekend at the beach and people clustered together. It's a remarkable debate. You never thought you would see Californians versus Californians, and the showdown continues here in Huntington Beach. Back to you now, Fred.
All right, on to Oregon now. Officials are reporting a spike of more than 1,200 new cases just 1 week after allowing hair salons, gyms, bowling alleys to reopen. CNN's Natasha Chen joins me now from Alpharetta, Georgia, north of Atlanta. Natasha, well, I see a lot of people out behind you.
There are a few more people now within the past hour, Fred. What we're seeing is that the mall here in Alpharetta is trying to make the walkways one way so that they can avoid cross traffic and getting too close to people. But we do see that there's some people